Good morning. I find that when I'm walking, it's a great time to chat and catch up with others. And I conceived of this idea, this exchange from walking and talking with some of my colleagues at times when we had our one-on-one meetings, etc. And one in particular, I just got off the phone with Dean Giannakis, who's the Chief Academic Officer at Centra Health. When him and I worked together, we created the Clinician Leadership Program. And it's great talking about what he's working on now, what they're doing with the program, and how it's developing and growing. And it's funny, I remember when he and I were first starting working on the program, he was all about, just getting it done, launching, and physician leaders for years had talked about doing it, but they worked on it and then they'd leave or they'd go to another role and kind of pass it on. It never really got started. And Dean was determined to get it started. And I like to think of myself as an action-oriented individual, but for him, even though he's a very thoughtful and deep thinker, he was like, let's just launch it. And so we talked about it and we decided to launch it ugly. For those of you that haven't heard that term before, but launching it ugly meant throwing it out there as best we could. And it actually was really good. The first year was good. And every year after it just got better. But it's funny because we all perceive ourselves differently. And, we were talking and Dean was saying that he, years ago now, he was saying that he saw himself as someone who needed to work on being more action-oriented, someone that needed to think less and act more. And I was like, Dean, you're one of the most action-oriented persons I know. Like, you get it done. But yes, you bring in the right people. Yes, you have the conversations. Yes, you think about it, ask the right questions. But you don't wait. You execute. And so I was always really impressed with that. So if he was ever not action-oriented, he's not like that now. And it's just remarkable to think about how sometimes we perceive ourselves so differently than others perceive us. And thinking about perception, I've gathered a lot of value from others' perceptions that they were willing to share with me of me. And so, to give you an example, I've had physicians that I've worked with that would call me Pollyanna, say that I was overly optimistic, overly positive. And I had this one leader who started saying that I was being a Chicken Little and that I needed to stop being a Chicken Little. And at first I took that as a little bit offended. And I was like, what is she talking about? This is not what everybody else is saying. But then I, reflected on it and said, okay, why is she experiencing me in that way? And what is it about our interactions that make her feel that way? And so, I realized that you show up differently for different people depending on the situation. And I would often focus on the positives, focus on what needed to get done, focus on moving forward with the frontline staff, with the frontline people, and then bring the concerns that I have and the challenges that we're facing to her, as my boss. And maybe it wasn't the most productive way to do that. And so I learned to do that more productively, and because everybody can get overwhelmed if you're too negative and you talk too much about the problems and less about solutions. So I learned that I needed to focus more on solutions, on bringing a plan of what I should do to her. And this early career kind of learning helped me tremendously. And her and I to this day have a great relationship. And she gave me this little stuffed chicken, this little red stuffed chicken that I still have, that I keep in my office to remind me not to be Chicken Little, but also not to be too Pollyanna either. So I know it's just a kind of a hodgepodge of conversations today. I love working with people, find great value and the people that I've been blessed to be able to work with and around and in the teams with. So I would encourage you all to look for the great things you can learn from the things people say about you, to you, and from the examples of others that surround you. Have a great day.